Hello, everyone, and thank you for your words of wisdom, David. So, what is whole body cryotherapy used for? If you looked at the cryotherapy business websites, you would think that it's the new fix-all. According to a consumer update from the FDA, it claims to do everything from rejuvenate skin and release weight to helping to ease your fibromyalgia symptoms. There is little to no evidence for these claims, and it comes out to be a bit of a snake oil. While some patients may experience placebo effects, it's important that patients not use whole body cryotherapy in place of proven medical care. So, what should whole body cryotherapy be used for? And what are its indications? For multiple sclerosis, according to a case control by Miller, it should only be used as an adjunct. For adhesive capsulitis, according to a randomized trial by Sang-Yul, the evidence is promising, but there needs to be a larger sample. For rheumatoid arthritis, according to a systematic review by Guillot, it may possibly be used for fatigue reduction in this population. For recovery, the results are unclear, trivial, or even harmful, according to a study of marathoners conducted by Wilson. So, might we see this in an orthopedic setting? We might have a patient come in asking about it for relief of delayed onset muscle soreness, but according to a Cochrane review, the outcomes for this are negative. And might we see it used postoperatively? Well, right now there is no research for postoperative patients. For adhesive capsulitis, well, the outcomes are good, but larger studies need to be conducted. The study you see on this slide was conducted with an N of 30. It had a control group of manual therapy plus modalities and a experimental group with manual therapy, modalities, and whole body cryotherapy, and the outcomes were actually pretty good. As you see in this slide, there's a before intervention and a discharge range of motion for these shoulder movements. And as you can see, the whole body cryotherapy group actually had significantly better outcomes than the non-whole body cryotherapy group. But and we did our assessment of bias on this study, and we also found it to have a low risk of bias. But it's important to realize that this is just one study, and it only had a sample of 30. So I agree with their conclusion that more studies need to be conducted before we can use it for this. So, can whole body cryotherapy be recommended? Well, I think the real indication question is, when is whole body cryotherapy better than just an ice pack? Due to the poor thermal conductivity of air when compared to cold water, immersion or an ice pack, and the cost related to whole body cryotherapy, we would recommend that when using cryotherapy, we use traditional methods, such as an ice pack. We need to be careful and inform any patients that are considering this treatment that it would only be used as an adjunct and that they should prioritize proven means of treatment. So, whole body cryotherapy, not so cool.